understand that it's helpful to build capacity of mental health and addiction in primary health providers, because that's where the community goes. The community goes to the community health clinic. My name is Chris Whitaker, and I was diagnosed with schizophrenia in 1989. So this is my 25th, going on 26th year of my journey of recovery. And I currently see a family health team physician, family doctor, who prescribes the medication. She's my prescribing doctor. And I check in with a community psychiatrist once every 6 months and a housing support worker. So that feels good, and I kind of feel like I'm looking towards the white picket fence and sort of moving on with my life. I think an ideal situation of an interaction between a client and a CHC professional would be that the client would present and the clinician would respond in an empathetic way and reduce the stress right from the get-go. If the person comes in and says, "Hello, I'm Jesus," something like that, the response is not to think, well, this is not to confront the initial presentation, but to ratchet down the stress. Would you like to have a drink of water? You seem to be stressed today. Can we talk a little bit about this? And just ease that initial contact, and then respond to what the health concern of the person actually is. And then if things get kind of intense, then to step back and do self-care for the professional themselves, and then reach out and care for the person as well, and just make it a partnership. The best example I had in my experience, I still remember years later, was being in hospital and being fixated on this story, something that I believed happened earlier in my life, and writing it out and finding that to be somewhat helpful, but then wanting to communicate that. And there was a student nurse on the ward, I believe, who I asked to read this little narrative that I'd come up with, and she didn't challenge it. She didn't question me for details about it. Her first response was, "That's really something that you're dealing with, isn't it?" And I still remember that. It was a very good line, a very firm line. Didn't buy into it, but wasn't challenging it either. And that really did help me. And so I went on to say, I'd like this to be part of my chart. I was still wound up about it. I'd like this to be looked at and looked into and followed up with. And so she was cautious. She said, "Do you really want me to do this?" in a really helpful way. And I said, "Yes, very much." But then within about an hour, I had calmed down. I'd gone through that phase of my experience. And I went to her and I said, "No, I would like it back. This is private. This is something that's mine. And I want to take ownership of it, and I want it back." She pushed the boundaries, and she was creative, and she was client-centered. I really appreciated that. The community can become this resource space, so that we've identified where the challenges are, and there are challenges in the healthcare system. So if we're going to the front lines, where these people are really front lines, they're dealing directly with vulnerable clients in need, and to give them the resources and the tools, and with technology these days we can give them an online help and support as well. This community of practice would be a good forum to have that knowledge, that education, that awareness can help at least the next interaction that clinician has. If the clinician, the healthcare clinician, is supported, then he or she can reach out and support the client more effectively. We're starting something and we're building on it. I really appreciate that. That's what helped with me. I've been able to build up my support system from a few bricks.